starts. Okay, we'll start now. My name is Claudia Bartz. I chair the working group, Telenursing and Midwifery Nursing Working Group. And I'm happy to be here with my colleague, Veronique Silva, who chairs the working group on women. And Veronique has actually done all the work for this session. I'm just here as an added person. So I'm hopeful that this will be informative. I'm sure it will be. We have really great speakers. I would say that our president of ISfTEH may join us between patients. She's seeing patients this morning. So if and when she does, we'll just take a little break and she'll give us some words of wisdom and welcome, and then we'll carry on. So without further words, I will pass over to Veronique to introduce the first speaker.
Thank you, Claudia. And thank you to the participants arriving. We see them just popping up on the floor. We're very pleased today to have three speakers coming from Latin America. Angelica Baptista Silva from Brazil, Valesca Gatica from Chile, and Aleti Pinel from Panama. And we wanted to have them three together, not only from geographical purposes, because there is a kind of unity in eHealth in different continents, in different regions of the world. And of course, this webinar is not giving the complete page of eHealth in Latin America, but at least three perspectives that are very complementary. And we are happy to start with Angelica Baptista Silva from Brazil. Angelica is a researcher at Osvaldo Cruz Foundation in Rio de Janeiro. She coordinates the specialization on human rights, gender, sexuality, and she's professor, postgraduate in biosciences at Instituto Osvaldo Cruz. She has an huge experience in public health and work mainly in different topics: telehealth, telemedicine, digital health, information and communication technologies in health. Please, Angelica, that's your turn. Open your micro and we listen to you for 10-15 minutes.
And thank you, Veronique, for this generous presentation. Let me put the PPT there. Just a minute. Share. Just a minute to put the first, okay?
That's fine, Angelica, you can start.
Okay. First, I would like to welcome my companions Valesca, Arleti, and Claudia to this webinar. And I also want to thank Veronique for the invitation to talk about women in digital health in my country. I have followed this story of telehealth and digital health in the territory for over 15 years, and their stories are my story too. Let's go from global to local. This chart drawn from the Organization for Economic Cooperation and Development reports on the education and genders shows the proportion of women aged 25 to 65 graduating in the knowledge areas. Do you see the low scores for engineering and natural sciences? And the extremely low participation in the information and communication technology sector, the lowest of the graph. To look at my country, there are no official numbers on female leadership in digital health. That's why I had to use some research approaches to bring that into our conversation. And in Brazil, there are 45 special interest groups in the University Telemedicine Network. 54 women lead these groups, with a 73% of presence in the total groups. However, when we asked about the number of women associated with the Brazilian Health Informatics Society, I discovered that we occupy only 29% of the positions, going in the same tendency of the OECD's numbers. At my institution, Fiocruz, there is an informal group that has been working on innovative Fiocruz health, where more than 50% are people who declare they are of the female gender. Our ex-president, the first woman in 100 years, Dr. Nízia Trindade, is the current Minister of Health, the first in the history of the country in this position. Talking about this universe in such a short time that you gave me, didn't give me many choices besides this rudimentary statistical synthesis, and I borrowed a little of the qualitative research approach called life narrative. I'm going to talk about the story of some of these women to speak about Brazil, okay? In this slide, two leaders of Latin America, researchers and postgraduate professors. I don't know if Arlette knows some of them. I think she knows. On your left, you can see Alaneir from Minas Gerais state, most known as Laines. Laines is a physician and has PhD in information science. In 2016, she started to coordinate a project to establish the Committee on Best Practices in Telehealth in Latin America with Mundial Bank funding. She founded the Latin American Journal of Telehealth and many other things until now. Magdala, at your right side, is a computer scientist from Pernambuco State, elected the most influential person in digital health in Latin America by the Health Excellence Awards in 2014 because of her work as a coordinator of telehealth unit in Pernambuco. And she was elected one of the 100 most influential people in health during 2015 Global Hospitalar Meeting. She's also a fellow of the International Academy of Health Sciences and Informatics, and I'm honored to say that she evaluated my PhD thesis about telehealth years ago. You can see on your right side, Dr. Alexandra Monteiro. She is professor and a physician in Rio de Janeiro State. She was at the beginning of the National Telehealth Project in 2006 and organized the first master professional degree in telehealth in Brazil. Now she's coordinating the first teleconsultation service of a hospital in our public health system. Clena Sarges, on your left side, is the leader of an innovation lab in Fiocruz and created a beautiful project named Hack Girls to stimulate young and poor girls to innovate and create scientific solutions for society. Hack Girls is in the second edition this year in 3 cities of Brazil. Now you see two warriors, one from the north and the other from the south of the country. Valdeide coordinates Telehealth Amazonas Unit, a crucial center to Amazon forest and permanent education of health professionals. It helps the health professionals in isolated areas, the forests. Cristina Calvo coordinates Telehealth in Santa Catarina Unit, which offers decentralized radiological imaging reports at the national level to other telehealth centers. Both of them with large teams and responsibilities in the public health system. And finally, the face of Brazil. Juliana Zinada from Goiás State led the general coordination of innovation and computing of the Ministry of Health for 3 years. She led the creation of the National Health Data Network, a fundamental infrastructure for the computerization of health in the country. There, she appears with what she claims her biggest project, her São Miguel. Ana Estela Haddad from São Paulo State was appointed by the current minister, Dr. Nisia, to be the commander-in-chief of implementing digital health in Brazil. With extensive experience in the area and being a participating member of this society for years, you know that, she brings hope for a qualitative leap for the country in telehealth and digital health. From these brief words about the life stories of these Brazilian women, we can highlight a few issues. Boaventura Souza Santos say the epistemologies of the South bring voices and are a source of hope in adding other types of knowledge and source for the humanity. Not only he, as other authors, are an inspiration for a discussion of a new set of human rights related to the preservation of the civilization process. In this phase of capitalism that some call digital transformation. In this sense, it's necessary to have an ethical reflection and the help of the human sciences to think about the digital ecosystem of healthcare beyond techniques and new devices. And in conclusion, we can mention these three questions. There is a little or no information about the female gender voice in digital health. Humanities are crucial to understand the impact of digital transformation on health. Intersectionality and consubstantiality, difficult words for me that say in Portuguese, of social relations have to guide the public policies. Let's hear the voices and the needs of immigrants, the LGBT community, people with disabilities, and the older population. It's necessary to have technology against ageism, xenophobic actions, and structural racism. So is it. Here are some references. I hope you liked hearing a few about these wonderful women that represent many others in my country. Thank you.
Thank you very much, Angelica, for presenting those wonderful women. Really, we want to meet them all. Should they be Alanair, Magdala, Alexandra, and Lena, just to say a few more, a few ones. It's really exciting, but that's what we see since 12 years now that we are currently working in the theme on women in digital health with Arleti, for example, started in the conference she organized in Panama in 2012. So let's say 11 years, we try to capture the elements, the information, the data on where are those women, who are those women, what are they doing? But it is still very complicated to have the entire information and to know where they are, how to reach them, and how to ask them to come to our webinars. And probably we will ask you to organize an entire webinar on Brazil with all those women together for them presenting what they are doing in the area of digital health. I'm very happy to tell you that still I have no questions on the discussion, but there are 27 participants coming from USA, Netherlands, Panama, Germany, Botswana. Good morning to all of them, and thank you for being connected with us. We pursue our presentation with Valesca Gatica from Chile. Just to tell you that I am also, whoa, I don't see anything on my screen. I hope that's okay. I'm born in Chile, in the south of Chile too, in Concepcion. She's at the University of Talca. She's a physiotherapist, neurology specialist, Borstra therapy, Master in Human Psychology, PhD neuroscientist, founder and creator of Telerehabilitation Technology Center and Neurosciences in Human Movement in the Universidad of Talca in the south of Chile. Please, Valesca, you have the floor. We listen to you for 10-15 minutes. Thank you.
Hello, everyone. Thank you for this presentation, Veronica. First of all, many thanks for this invitation today for me and my team. It's very important. Okay, in the next slide. Chile is a South American country with a population of a little over 16 million. It's long and narrow, as you can see here, with diverse geographic and climate, such as mountain, valleys, ocean, forest, and desert, making access to healthcare difficult, very difficult, and elevating costs for patients and the government. Therefore, this diversity has motivated our work at our technology center, TTCM. We have identified two factors: geographical diversity. Also, the growing elderly population has inspired the creation of our face-to-face and remote rehab protocols. Next, I invite you to know our history. We were born in 2040. We built a lab and began to perform clinical trials with other adults and neurological patients. In 2019, we evolved from being a lab to a technology center, TTCM, and mid-social crisis, then followed by the pandemic. During 2020, we implement a tele-rehab exercise program. Then we achieved our first patent called My Virtual Physiotherapist. My Virtual Physiotherapy, and our second patent, Smart Mesh, was reached in 2022. In 2021, we created two companies, ISfTeH Hardware and Therapy One Software. Okay, now I will show the main problem treated in the clinical trial. For this, I will focus in older adult, specific in the loss of balance, because one of the most compromised physical ability is postural balance. To keep balance allows functional independence, health status, and quality of life, whereas impaired postural balance leads to fall that can cause hip fracture, for example, which had an elevated mortality and comorbidity in this population. Okay, this technology in older adults. Here is the technology we have created, Vir Therapy, My Virtual Physiotherapist patent, and Smart Mesh patent. Vir Therapy is two-dimension exergame. Now, why we apply all our software to smartphone? Because everyone has a smartphone in the world. This, My Virtual Physiotherapist patent, it has two components. One is the smart sensorized teacher. Two is the software. The teacher sensor are inertial and capture the movement and posture. This data is transmitted to the smartphone or iOS. Next is the smart mesh pattern. It has two components. One is the mask. Here, you get this image. One is the mask and neckband, which collect data. For example, heart rate, oxygen saturation, and the neckband, they capture the moving and posture. In the second component is the software. The other image, the smart mesh. Okay, this next slide is very important because I will mention the technology readiness level of each patient in the level it will reach in near future. For example, today, my virtual physiotherapy is a TRL2, and thanks to a grant of $250,000, it will reach TRL8 by 2024 approximately. During this year, Smart Mesh will reach TRL7. With the grant mentioned, we are creating a new software and technology integration using my virtual physiotherapist teacher. In this slide, my virtual therapist with an interdisciplinary web app software. This software had many disciplines. For example, geriatrician, physiatrist, physical therapist, occupational therapist, nutritionist, speech therapist, psychology, and nurse. This integrate software and technology will be able to monitor, evaluate, rehabilitate, and treat other adults from home, for example, social clubs, foundation, hospital, community center, and private clinics. Yeah, this is my presentation. Many thanks.
Thank you very much, Valeska. Definitively, the world is aging. This everybody agrees on that, and the WHO too. So those different materials, as the connected T-shirt and all that you have been presenting, are absolutely needed. Everyone in its family has an old daddy, mommy, or aunt or cousin that would benefit of what you're developing. And I'm very excited to know more in the next months and years on the development from TRL3 to TRL7 this year and upper in the next year, and to follow the development, but also the expansion and the use of all those different materials, digital materials. You're right, mobile phones exist everywhere. And I can tell you, in so many places in the world where there is scarce electricity and no clean water, and in many places, we all know those places, Angelica in Brazil, you in Chile, and Atleti in Panama, right? But they have mobiles, and the young girls, hackers, have mobiles, and they are in TikTok, Instagram, Snapchat, and just sharing everything. So this is an immense power to reach those living far away that cannot have the attendance to a major hospital or clinic. So it's very exciting to continue and to look at how all your program is evolving in Talca, and hopefully you will be able to present it in upcoming conferences in the next years, 24 and 2025. And it will be an opportunity to meet all together face to face too. Thank you, Valeska. I don't have questions at the moment.
Can I ask a question, Veronique? Is there time?
Yeah, of
Question.
course, please.
That gear that you described, the headband and the O2 saturation monitor and the jacket, do people, is the idea that people will wear those when they're having their training so that they don't fall? Or will they wear them a lot, like at home? Or how are those pieces of equipment? I'm fascinated by the headband with the oxygen saturation measure. How will those be used by people?
Yeah, many thanks for the question. I understand my English is not good, but I understand that your question, because this technology is possible that use when you stay in the home, when you training, for example, when you walking, many possibilities. That this technology is possible that integrate technology, for example, mask, neckband, and teacher, but only alone, only mask, or only neckband, or only teacher. Yeah, this possibility, for example, in my presentation, I refer it only early population, because it's possible they use it in neurological patients, for example, in sequelae of stroke, Parkinson's disease, and cerebral palsy, Down syndrome, for example. Yeah.
Very interesting. And the grant that you received, that's very impressive. Will some of that money be used to provide this equipment to people who need it?
Sorry, I don't understand your question.
You said that you received a grant for your work.
Yeah.
Funding. And I'm wondering if some of that will be used to provide this equipment to people who need it in the community or wherever.
Yeah, I understand. It's possible. The technology integration, you need it. Yeah.
Fantastic. Really good. Very enjoyable. Thank you.
I think the perspectives are really very interesting. Valeska, do you see major differences from the gender basis, or differences between patients, male or female patients, in wearing the t-shirt, the headband, or are they having the same interest in use of those materials?
Yeah, thank you for the question, because all technology have a different possibility for the men or woman, children or teenager, different, for example, small, medium, and large. Yeah, it is possible, because these elements all contemplate in this technology. Yeah.
Okay, thank you very much, Valeska, for your wonderful presentation. And we pursue with Aleti from Panama. Aleti has a long career, and she is an authority, really, and I can say it because I know her well, in global health, in ICT's development, and the use of new technologies to improve programmatic outcomes. She's been working a lot in HIV, sexual reproductive health, maternal health, newborn, child and adolescent health, with disability and aging. So with her, we come back to that theme, but also mental health, where we see that now the issues after the COVID period are at very high levels everywhere. She's a negotiator for grants and fostering policy dialogue in low and middle income countries in Africa, Arab states, Asia, Eastern Europe, Central Asian republics, Latin America and Caribbean. Let's say, in short, everywhere the world is yours, Aleti.
Except Antarctica.
Who knows? Who knows?
Well, I'm still gonna get there. It's in my bucket list. But thank you very much. I'm really glad to see all of you. Some of you that I know since we were spring chickens. But anyway, I think that the important element here is about community-centered responses. How can communities come together? Because especially in Latin America, we're sort of sandwich. We're not poor enough to receive development aid. We're not rich enough to have the systems in place that can provide funding for these types of things. And governments are usually interested more in bringing private sector investment for wealth creation rather than social protection. So this initiative comes from the perspective of how can you strengthen communities to find their own responses. So we know that the world is aging. Every single country in the world is aging. And in Latin America, it's aging exponentially, as you see from this graph. And shortly, we have a little bit more than 120 million people. We have doubled in the last 10 years. And shortly, we will have, by 2040, more people over 60 than under 14. Yet, most programs are not looking at aging. Even here, I'm here in Geneva for the World Summit on the Information Society, and aging is not part of the agenda at all. There's some mention here and there, nothing about aging, and much less about ecosystems for aging. But for us, in this program that we have started in Panama, we based it on the principles of inclusion and equity because we really believe that all of us have the right to a dignified life. So we chose a neighborhood in Panama City called Betania that has the highest concentration of people over 60 in the city. This was from 10 years ago, so we're probably closer to 20,000 people over 60. And I really want to, first of all, give thanks to the local government of Betania, the Junta Comunal, that has been instrumental to not only organize, but to provide the environment and the infrastructure to be able to work with this. Also, the Technological University of Panama, that has been our partner in crime for many, many years in trying to set up things. But it's a very good sample of cutting across elements. And we started first thinking on digital health. So how could we test a digital health platform designed for older people in the community? It was supposed to be simple, 3 months, and then we would see what we would do with this platform, Cuido, which is from the Basque country in Spain. Two problems. The first one is that there was not a favorable ecosystem for healthy aging. So we had to start to form the coalition. And it took us about a year to get actors involved from the central government, the Ministry of Social Development. Well, I already mentioned the local government, the congresswoman that was in charge of that region. Most importantly, senior-led community-based organizations where we're going to base all activities with the support of of all the universities, 3 universities, starting with the Technological University of Panama. We also, and the Catholic Church. So it took us a while, but right now I think we have an initial coalition that could help really not only implement this in Betania, but use it as a model that can then scale up in the country. The second thing was interesting. Health was not a top priority for the elders. Priority number 1, financial security. Number 2, food security. 3, mitigating loneliness, and only then health. So we said, okay, we can't do a test with digital health if it's not really a priority. So what we did was take a development and silver economy lens to it. So what are we seeing here? And then we started building a knowledge sharing and productive ecosystem to address all those priorities. And that's how eSilva was born. eSilva still is a fledgling movement, if you will, coalition to reduce the digital divide, to be able to improve the quality of life and health of older women and men, to have intergenerational ventures anchored in the community. We need solutions there, and to promote digital activism of older persons against ageism. And I think this is an important element because the generation that is now old in Panama were actually instrumental for a lot of changes that we have right now. Anything from women voting, social security, political involvement, but the activism, of course, has come down because people can't leave their homes and can't be outside protesting and whatever. But they have the energy, and that's the important part. So eSilva is basically a community-based silver economy that is responding to the needs of seniors through locally relevant, sustainable, and collaborative ways. And we have 4 arms. The first one, digital literacy. The second one, digital health and well-being. The third one, an e-marketplace where you can set products and services by and for seniors so that they can participate in the digital economy. And an incubator, an intergenerational incubator for community-based SMEs, small and middle enterprises. And I think that what we tried to do here was bring together all those 4 priorities in a system where people can actually benefit at different phases from different ways. And the digital literacy component that we thought was going to be an appendix, if you will, or just an instrument to get to all, has actually turned out to be the core and the most important element, because without digital literacy, you don't create value in technology. So what are the results that we have to date? The first result is an attitudinal change, a change of mindset regarding technology and mindset in terms of intergenerational work and multi-sectoral collaboration and interinstitutional collaboration. All of a sudden, these things have come together. The key result is infrastructure and connectivity. I took this picture because several months ago, this NGO that is it is community-based group of elders has been around for 30 years, but for several months, it didn't even, the roof fell down and was in terrible conditions until the local government managed to build it up. And now it's a top-notch environment with connectivity that permits this NGO to be one of the core participants of the project. A third result was the digital competencies and buy-in for digital health. We had elders of 90 saying, I thought to myself, why am I going to go and get involved with digital stuff if I'm going to die soon? And then all of a sudden I realized what it was about and what I can access. And I want more. I have a whole list of things that I want to learn how to do. And I just chose this picture here because it actually was done through digital imaging by one of the elders from the group. And a fourth key result was advocacy, the need to actually put forward in all sorts of media to be able to showcase the fact that we have to look at aging as healthy aging, productive aging, as an aging process that is based on every person's right, but that you are an important element of the country's economy. Some key challenges, of course, still remain. The first thing is weak promotion. Unfortunately, the public health has inversed. It used to be that we used to go to where people were, and prevention was the core. And now we sit in a hospital, sit in a clinic, and wait for people to come. And when they come, of course, they're sick. So it's very difficult now to regain health promotion and all the elements that in case of the aging, in aging, you also have to control the chronic diseases and really have that preventative approach, which is what we're really focusing on. Ageism, prejuicios. So everybody after a certain age is deemed that, Rob, everybody's fragile. See, I'm so fragile here. I can't even deal with this presentation. We have to break this thing. The issue of digital health also, after COVID, there was an explosion of digital health, but people think that digital health is just teleconsultation. And people don't know about the wealth of digital health. So we really have to, and I love Valesca's presentation, because it shows that the future of digital health is wearables and IoTs and all this that have to be integrated, and not just teleconsultations. There's a lack of development perspective in health, especially when you're planning for digital health. It's all about gadgets and technology. And we still need more intergovernmental coordination. And of course, funding and sustainability, especially with what I mentioned before about the conditions of Latin America. So to conclude, first of all, we need to understand that longevity is the result of successful development. If you want to be healthy older adults, we need to have healthy childhoods, adolescence, and adulthood. So it's all linked. So don't tell me that, we're just going to do a program for young people or whatever, just for that bracket. No, that is essential to have healthy aging. And we see it with nutrition, for instance, a very core. Many older people are undernourished. And part of it is from all the issues that come throughout life. Part of it comes from loneliness. Part of it comes from not attending to the fact that they lose teeth or things like that. So, and nutrition is crucial for healthy aging. And for communities to be able to to really engage and embrace and take ownership of digital health initiatives, it is necessary to identify digital health as an entry point to improve people's lives, not just health. If you don't deal with all the ecosystem, very unlikely that people will adopt digital health. You need to create value to technological solutions, as this has been done by this very vibrant intergenerational environment that has been set using the students of the technological university, and young people and the elders participate in the design and implementation of the program. And again, giving emphasis to digital literacy. And right now we literally have one young person to one or two elders, and they get their act together to be able to learn about this. And it's not just about pushing buttons to talk, learn how to do WhatsApp to talk with the grandchild. It's about e-banking. It's about calling an Uber. It's about participating in society. The late Reverend Desmond Tutu used to say that as we get older, our rights do not change. And as we get older, we're no less human and should not become invisible. And this should be a reminder to all. And to end, I'm just going to invite you all to the first Ibero-American Silver Economy Forum that will take place in Panama, October 3 to 5. And it's centered around inclusion, opportunities, and digital transformation. Thank you very much.
Thank you very much, Letty. And it goes along from years and years that you are working, you've been working in HIV/AIDS, saying the same. I remember you saying the same about 15 years ago in Geneva, that it is putting all the elements together that makes the real solution work. But that's my question. From a funding perspective, it's almost siloed. And I see that in maternal health. Mm-hmm. It's difficult to have a global funding to enhance health, financial issues, literacy, educational, all together, because they come from diverse funds, diverse organizations that don't work together. And really congratulations for putting all those different people together in Panama, because really this is a very hard work. So congratulations for all the work. I'm very excited again, and also to see the expansion of what of eSilver in the silver economy, definitively. Yes, I have a question from our participants. We're 32 participants. It's growing. Thanks for the participants coming from Romania and Atlanta that have been reaching us. And I have a question from Plena Sarges, you know, the hacker from Brazil in Rio. She asked, and I think the question is fine for you three. In your opinion, do women carry out the empathy phase in design more carefully? So I don't know exactly what she means, but yes, I think this axis of empathy, that the design allows differences, allows a variety, not only a single model, but a variety of individual perspectives. So is that really promoted by having women like you in the research and development teams? Angelica, maybe you can start replying if you have. Move your micro, Angelica. Right.
Okay. I think Valesca and Arlette can talk about it too, and it's the intention of Plena. But I think it's difficult to have funds of projects led by women, but we have this care on design thinking to the user, the final user. Our products are centered on the user, on the thoughts, and to hear. I think it's our gender vision of here, so much of the ambient to after thoughts. It's simple like that, but I think my companions can answer too.
Thank you, Angelica. Valesca, what do you think when women are in the design phase? Do they put more empathy in the design of the program?
Okay, in my experience, the empathy in the woman is very important, because in Chile, the government specifically promote that development technology in women and promote the research in women. It's very important. Yeah. For example, in my presentation, the funding in the project, approximately, maybe totally women in research. Yeah.
Thank you, Valesca.
Thank you.
Just go ahead if you have more to say.
No, I when I'm thinking about the question in the chat, TTCN, my center technology, we have funding the government, but it is very important in the future to reach the funding in the companies, private companies. It's very important. Yeah. Mm-hmm. Thank you.
Veronique, do you see the message from Michelle?
Yeah.
Yes, okay. I saw the message from Michelle.
Okay.
And
sorry.
Yes, she cannot join us, so we will pursue the webinar without her.
Okay.
She's too busy. Aleti, something on empathy, and we have another question on funding.
Yes, in terms of empathy, I prefer to think that men and women work differently. And instead of empathy, I would say that women are more lateral thinkers. So they're more ecosystemic and inclusive when they're trying to address a problem. And probably that is one of the reasons, if you look at the research on startups, whether they're startups or community-based endeavors or whatever, women-run groups do much better than male-run groups. And probably it's that component of being able to also be more nifty, be able to change more rapidly instead of having a more linear type of approach. In terms of women, older women, there's a very important element in here, and that we need to really stress the importance of looking at women. First of all, women tend to live longer than men. And when they live longer, they tend to also be more alone in the future, because men tend to marry later after they are, widowed or divorced or whatever. They need somebody to take care of them, I guess. But there are more women living alone.
Yes.
Women are by far the caretakers, the formal family and informal caretakers. And women have not only have a greater burden of disease, including dementia. So we really need to look at older women, not because they're better or we need to, but there are very particular elements of aging in women. And that includes also money. When you look at the CEOs of the world and whatever, and how many CEOs are women, but take a look at the age. You have older men perpetuating themselves in the economic power, and women still struggling to be able to have a role in the decision-making of financials. So I'll stop there.
This is really very true, Aleti. And we all, as women, know that really it happens at every level of the economy, in banking, insurances, health also. Director of major hospitals are male, and they auto-generate themselves.
I'm in a VC lab. I'm in a VC lab program in Silicon Valley. Very interesting times to be in there. But yes. I'm probably the oldest person in the group. Everybody is in their 30s or whatever. And the women's group come together, and these young women that are bright, that are wanting to have venture capitals, and they have passion for things. And the questions that they always ask are the same ones that I used to hear when I was 30. How do you sell it to a man when the men have power? How do you have to dress so men don't think that you look like a sex worker or whatever? It was, we need to do more work.
Yes, definitively. We have a question from Douglas Colin, who is listening to us from Atlanta. In Georgia, USA. Are you reliant on government funding, or are you looking for corporate private source funding? Ladies, the floor is yours. Who wants to say a few words on funding, which is a key issue for women and men? Anyway.
I have some comments about that, but I'm going to first leave it to Angelica and Valesca to reply, because they come from countries that have a larger financial ecosystem than Panama or the rest of Latin America.
Wait, Angelica.
Okay, we catch the government funding mainly. The private sector is interesting, is different from the governmental. The people with disabilities or older that are poor is not the target of the private sector. It's difficult to tell them to help us about it. But there is a capital for startups in Brazil, a capital that, and people are creating solutions with AI integrated to health that are interesting. That's the private sector, the investors. That's what I am seeing in this area in Brazil.
Right. Thank you, Angelica. Valeska.
Okay, our experience is that in this moment is the funding of the government, but it's absolutely necessary the funding near the private companies, because and now my team, my center of technology work in different politics for inside in my university and outside the other university in my country for facilitate the funding the different private company for funding the development, the technology. For example, smart mess, my virtual physiotherapy, and other technology.
Thank you, Valeska. Aleti.
Yes, I think that one of the advantages of Brazil and Chile and a couple of other countries in Latin America is that the government does put funding into these efforts, either for research or for innovation and technology. This is not the situation in most Latin American countries. And what you see right now is in the latter years, having a lot of venture capital funding. I mean, it's incredible. It's millions and millions of dollars, billions of dollars actually, being flooded into Latin America for investments in health tech and whatever. But everybody looking for a unicorn, right? Nice. And we don't need unicorns. We need a bunch of donkeys that can go and work and take and, and continue the work. Regardless of the Silicon Valley Bank or the Credit Suisse, we need people that can actually be able to look not at people as consumers, but people as productive elements of society. And this is a moment, and I've been saying, and you've heard me, Veronique, for 20 years on this thing since the Global Fund, about the need for Latin America and high-income countries, high middle-income countries to start looking for blended funding, innovative funding, ways in which we can harness the potential what everybody can give. Especially now after COVID, countries are in debt, to the Interdevelopment Bank and whatever, because the only solution that governments have, is loans. So we're up to here in loans. So you cannot expect the government to really start putting a lot of money. And for the Panama project, for instance, everybody's putting whatever they can. The local government puts whatever it can. The ministry puts whatever it can. The pocket of a few of us bootstrap the program and whatever. But it's a great opportunity for the private sector to understand that the investment in communities, the investment in social capital, and the investment in social innovation is key to be able to have innovation for the future. Because it's not, you can think about 5G, 6G, 7G, all the Gs that you can, but what is going to happen? You're only going to increase the gap. And if you really want private sector, if you really want users to consume your technology, you better start using whatever you can in terms of creating social capital to be able to close that gap. It's the only way that you can do it.
Thank you very much, Aleti. Look, Aleti, you are already a very famous researcher, known all over the world. But now you are getting even more famous, I can tell you. Douglas, Lisa, Britta, they all, and I love your not unicorns, but donkeys. I think this will remain written somewhere in that webinar, and we will use it in other webinars definitively, because it fits the image immediately.
And in the terms of the other regions of the world, maybe camels. But the issue is that unicorns don't exist, and when they pop up, they disappear in the pockets of a few.
Fantastic, fantastic. Thank you so much to the three of you for presenting such exciting perspectives. And of course, we will continue to be in touch and pursue the conversation in the coming months, maybe in Panama, 3-5 October 2023. Is that right, Arleti, or 2024?
No, this year.
This year. So this year, 2023, we will try to have a next webinar together with Telenursing and Midwives Working Group and Women Working Group at the International Society of Telemedicine and eHealth during the conference, the international conference happening in Winnipeg. But yet we're not done. We will try to do our best, and please continue following us, and we will give you more information on our next webinar very soon. Thank you very much for the three of you. Claudia, I'll let you close the session.
Add my thanks. Really great, really informative. Yes, good.
So
thanks.
Thank you very much.
Okay.
See you very soon, ladies,
Bye.
and
Thank you
we
to
keep
all.
in touch. Thank you.
Bye.
Bye.
Thank you very much.
Bye.
Goodbye.
Bye.
Goodbye. Thank you to the participants and for their questions. Thank you.
Yeah.